Good afternoon, everyone, and welcome to our live chat today. And today we are going to be having a conversation about delivering medical education remotely during the COVID-19 pandemic. I'm Prescott Stokes III, the Integrated Content and Marketing Manager here at the TCU and UNT-HSC School of Medicine, and I am happy to be here with our founding Dean, Stuart Flynn.
Good afternoon.
All right. We are also joined by our fine medical students, and we have 4 of them with us today. And the very first is Sharna Kennard.
Hi.
We also have Dylan Shaw with us.
Hey, all excited to talk to you today.
And we also have Connor Rodriguez.
Hi, everyone.
And last but not least, we have Sarah Lyon.
Hi, everyone.
All right. All 4 of them are first-year medical students here at the School of Medicine, and they will be answering any questions you have about their experience at the School of Medicine, and Dean Flynn will be answering any questions you have about delivering medical education during the pandemic. So before we get to any of those questions, let's start with Dean Flynn. So Dean Flynn, can you tell me what has been your biggest challenge leading the medical school during the pandemic?
The biggest challenge is one I hadn't anticipated, having never experienced it before. I think we were nicely prepared in our flipped classroom model to deliver curriculum remotely. What I wasn't prepared for was how powerful, in a negative way, not having our students be together and having faculty and students be together. I think we've done a very nice job, thanks to the students in this meeting and their classmates. It isn't something I would want to do for a 4-year medical school, but during this crisis, I think we're doing fine. And then secondly, a couple of limitations just by the sheer nature of social distancing and the like. Our anatomy course, we've had to change how we're delivering some of our anatomy. Our students are not able to see patients, and right now we don't have them seeing standardized patients, so they're still doing history taking and communication with standardized patients through this venue, but they're not able to do any of their physical exam at this point. So those are big negatives, but again, we'll come out on the other side of this, and we'll catch up very, very quickly.
And what portions, I guess just in your experience as everyone has been going through this for the past 2 months, what portions of the curriculum have seemed to work better remotely?
Yeah, I'm not sure what I would say has worked better. I think the students, when they weigh in, maybe they can tell us, since they're actually living it. You know, from going into my home office and delivering curriculum, that's pretty convenient. Doesn't always mean I put a tie on, so maybe my professionalism starts to fade away a little bit. From my point of view, a lot of it has felt quite similar. But again, I would rely on the students' feedback on this. But to be clear, I don't covet this long term, but I'm really pleased that we could keep their training going at a pretty nice clip and didn't just have to stop and then figure out where we're going to make up 2 or 3 months at another point in time.
And, you know, just hearing you say that, with our medical school having a new approach to delivering medical education, do you think we were more poised to be able to respond to something like this already beforehand?
I think, obviously, I would love to tell you we set this up anticipating a pandemic, but that wasn't the case at all. We were actually, you know, teaching medical students in a different fashion than sitting in a lecture hall and being spoken to. But the answer is absolutely. We were a little bit of the exemplar for TCU, so they learned a fair amount of lessons from us. Now, granted, we're different. We have a small class size, so we're nimble, but we could share some best practices with them. And so, yes, to answer your question, we were quite prepared for this.
And one thing I do want you to talk about is the future accelerators of medicine and beyond courses. So we have had these courses since the students have began medical school last July, but I know you added a new wrinkle with something for COVID-19 right after things went to remote learning.
So this course, as you said, Future Accelerators. So the course points to 2030 and beyond. So these are not things that exist today, but we're anticipating in a very short period of time, i.e. a decade for our students, these will be mainstream. So we've had such things as the role of genomics for every person in our society, which will be a reality when our students are early in their career practicing. We've had artificial intelligence and machine learning. Once again, it's already permeating medicine. People just haven't put the markers on it. So when this pandemic hit, we had 1 week left of the FAB course for the year. And, you know, it doesn't take a lot of effort to figure out that why would you point to 2030 when you're living through something that no one other than somebody 100 years old has lived through before, i.e. a true pandemic. So we adjusted pretty quickly to that. There's nothing like learning something live time. I grew up in the earliest phases of HIV before we knew it was a virus. So I've lived through this a little bit and how unsettling that is. We did not try to teach a lot of the science behind it. So for instance, when we did our FAB week, this Kawasaki-like disease that young children are getting, that had only poked its nose out. There were just a handful of cases, and now that's a very serious element of science going on behind that. So what we focused on, long story short, was how this was impacting our physicians, both first responders, but the practices of other physicians. So we had 3 of our chairs spend time with our students. We had a CEO of one of our partner institutions, healthcare providers, talk about how this has tremendously affected his system, and it just has. And then lastly, we dealt with some of the ethical issues around this pandemic. And the one person I couldn't line up, he was just too busy and too popular, was the head of Tarrant County's public health department, who's a phenomenal colleague, and he would have been great for our students, but I don't think he slept for about 3 weeks in a row. So I just couldn't pull enough favors out to get him to spend time with our students. But the students can then weigh in, you know, kind of how it landed on them. And we were about 2 to 3 weeks of really understanding something big was happening under our feet.
All right. So what I do want to do is let everybody know that you can be a part of this live chat. All you need to do is just jump into the comments section, type your question, and trust me, we will get you some answers. So since we're still talking about our Fab Week courses, Dylan, I want to start with you. I know you love Fab Week. You've talked about it on our Instagram when you did your takeover. So can you just tell us a little bit of what your experience was like going through Fab Week during COVID-19?
Yeah, absolutely. I do love Fab Week. It is one of my favorite things at this school. I mean, I think it's so cool to be training for the reality that we're going to face. And I love that we did this quick transition into training for the reality we are facing right now. So I will actually piggyback off of what Dean Flynn said and say that talking to the CEO of Baylor All Saints was probably the most interesting part of the week, to see what are physicians doing even outside of just treating patients. What does physician leadership look like during a pandemic? And how do you manage a hospital? How do you keep a hospital afloat during a crisis? So that was probably my favorite part of the week. And in addition to, of course, learning the science and all the ethical issues as well.
Great. And we actually have a question. So thank you. I want to thank Sam Saeed for asking a question. So this question is actually for the students, and either one of you can take it. So the question is, have you maintained a collaborative effort with your colleagues during this pandemic? And if so, how have you done
I can speak first, and then I'll let my colleagues go. I think that our class has done an amazing job maintaining a collaborative environment for all of us to learn. We're lucky enough to have Zoom, so we're able to have group studying whenever we need to. A lot of us have bought whiteboards and different ways to teach each other. So we've really been able to come together and support each other through school and emotionally and mentally through everything that's been going on.
And Sharna, I want to just give you a question. How has this remote education affected you?
As far as the delivery of the information and the courses have been fine. But as far as collaboration, I clearly took for granted how much I worked with my classmates, and we would solve problems together. And I just think back to when we were at IREB, there will be Sarah in one study room doing this elaborate, beautiful map that would show all the nooks and crannies of a mechanism of action. Connor would be down the hall and he would have these super detailed, amazing study guides and notes that could give you some more insight or if you missed something, paying attention during class. And then Dylan comes up with the most amazing ways to remember things. So like his mnemonics are bar none. Like I love it. If I need to remember something, Dylan always has like a trick up his sleeve. So having that experience, I miss it. And as wonderful as Zoom is, sometimes it just can't compare to being around my classmates. Like our energy is so infectious, so energizing, and so motivating. And I miss my class so much.
That's so nice, Sharna. No, it's okay. It's okay. It's a very tight-knit class. So, Dylan, since Sharna has just bragged about your techniques, can you tell us a little bit about what your studying techniques were like before the pandemic and how you have had to modify them now?
Yeah, and I'm again just going to piggyback off of what Charna said. We'd all be in the IRA building studying before an exam, and you would just hop from room to room and kind of hop in and see what people are working on, see how they're studying. So my study technique before was innately collaborative because I was just talking to everyone and absorbing information that way. And now that we've switched to this Zoom reality, we have to be a little more intentional with how we're studying. So in some ways, I have gotten more efficient. But right now I end up just studying on my own and then doing a lot of practice questions with my peers. And thankfully Zoom is actually a really productive way of doing that.
And Connor, I want you to be a part of this conversation as well. How has some of your studying techniques changed since the pandemic?
Well, I think the biggest thing is just the change of environment. As everyone has said, we've I guess made a home out of the IRAB building, and having to study at home has been an adjustment. But I think for everybody, we've all been able to adjust fairly well for the most part. At least I have. And I think one of the positives to it would be that I'm not having to like drive around or walk around so much. I literally wake up and then walk 2 feet to my desk, and I'm able to start the day and end the day 10 hours later.
Right. I think another question I kind of wanted you guys to talk about was some of the clinical skills that you guys are still doing online via Zoom. Can one of you, I guess, Sharna, let's just start with you. Can you give us some insight on how it has been working with standardized patients through Zoom versus when you did it in person?
It is very challenging because I used to take the ease of making a connection with the patient as, oh, it's easy. We're going to talk. I'm right here. I can chat. I can move a little closer, or, I can give more physical or just body language type of support. And it's hard to always translate body language through Zoom. And then, man, like having to describe what you're going to do with a physical exam is just burned into my mind so much better than me kind of doing it through muscle memory and not putting a lot of deliberate thought into it. So like having to describe and articulate what I'm doing is definitely helping me in the long run, but I still miss being there and being in front of the patient.
And Connor, I want you to answer the same question because you did an Instagram takeover for us and you were doing a little bit of a physical with your roommate, Will, who is also a medical student at our school. How has working with standardized patients been different for you through Zoom?
I think there have been positives, negatives to it. I think overall, one of the things that we've had to adjust to the most would be just reading nonverbal cues over webcam and being able to take those and try to move forward with the conversation. Where do I take this? And just looking at, okay, I need to start and I need to get all of this information, but I also have a computer in front of me rather than a person. So it's just been adapting to that experience, but it has been really nice to be able to continue the experience with the standardized patients.
And we do have some questions. So I want to thank everyone for jumping in the comments and leaving your questions. You can continue to do that, and I will make sure we get you some answers. So our first question is for the students. Sarah, I think I want you to talk a little bit about this because you've been doing community work. So the question is, with all of this time for studying and class time and research online, how have you all still found time to do things in the community? So maybe you can tell us a little bit about the virtual blood drive, Sarah.
Yeah, I'd love to. I think, and maybe Connor will agree with me, I'd love to hear his take, but I think Connor was one of the people that started the PPE Drive, and I was one of the people that started the virtual blood drive. And it has been one of the most grounding parts of this experience and giving us a way to help when we have to stay inside. And it's been an amazing way to give back to the community and also to collaborate with our other students and the entire school to get everyone involved. If anyone is interested in joining the blood drive, please do. I know that the link is on the Facebook, so check it out.
Yes, the link is on our Facebook page, on our Twitter. It's on Instagram as well in our store, and you have until May 31st, right?
Yes.
So yes, make sure you get all of that information and safely make an appointment to donate blood because it is still needed. Connor, can you tell us a little bit more about the PPE Drive?
Yeah, absolutely. And I think one of the biggest things that made it possible to the I guess questions point would be that it's really been a huge group effort. All of my classmates, we've come together as a team to really divide and conquer the different parts of the PPE Drive, whether that's sharing posts on social media, contacting organizations, or even delivering some of the PPE. It's really been amazing to see everybody come together. And I think Sarah said it perfectly when she said it's really been a grounding experience for us. And while we do have medical school to do in addition, I think this has really been a great part to it all.
All right, so make sure you keep getting in the comment section, keep leaving questions. We will keep this chat going on. And Dean Flynn, I know you've been quiet for about 10 minutes now, but I have to come back to you because now we have questions for you, Dean Flynn. So our first question is about telemedicine. So the question is, how will telemedicine change medical education?
So I have a family in the background that obviously has ignored all my requests to be quiet. So I'm a little discombobulated. I can't get up and yell at them, so I apologize. The one thing I would say about this pandemic is many of my clinical colleagues, for a variety of reasons, have had no choice but to engage with their patients remotely, very similar to what the students just said in their clinical skills course. And it's been an epiphany for many of them. They never would have done it on their own. There are a bunch of reasons why. But now that they have done it, they actually find it a very efficient. And so I think one of the offshoots of this pandemic, and again, I think our students, when they start to practice, I think this is now going to be just a foundational component of patient care. Again, as our students said, you lose out on that very interpersonal in the examining room moment, but there are some real upsides to this. Patients don't have to drive to a medical center, find a parking spot if they don't have transportation. What they do have to have is a mechanism now to communicate remotely. So I actually think when we look back on this moment, maybe a decade from now, this will have been an amazing transformation in healthcare delivery as a result of this pandemic. That's my prediction, but if I'm wrong, try to find me.
And we also have another question for you, Dean Flynn. And this is about supporting mental health for the students during this time. So the question is from Tom. Thank you for your question, Tom. It says, one of the concerns that work-related and school-related that leaders have to deal with is finding a way to support employee and student well-being on the mental and physical side. So they want to know, how are we supporting the students outside of the classroom right now?
Well, again, I would say, I think hearing from the students, because hearing from me is, I try to help lead this from above with some great colleagues, but I think hearing from them and not always just hearing the positives. This is daunting, as I said at the beginning, and it's daunting to all of us, not just students, not just faculty, but my next door neighbor, and we can go down that list. We have I would say, in my experience over my career, an exceptionally robust student wellness component that is not only necessary, it's appropriate, but over easily 3/4 of my career, that has never even been a point of conversation. It is now at every medical school, so it's not that we're so smart we're doing it, but we have a fair number of mechanisms for our students, from coaches to the Mayo Clinic ability to kind of self-assess oneself and wellness, communication, student affairs office, and the like. And it probably differs from student to student, which components they advantage and which ones they find most useful. It's a focus for us, and we need to constantly hear how it's working and improve it. And this is new. We're now testing the system through a remote education component. That's not how we designed it, but that's how we're using it right now.
Right. And we also have had some questions come in for the students. So I'm sorry, Dean Flynn, I wanted to continue this chat with you, but let's move back to the students. So Dylan, I have a question for you. What advice would you give our incoming students that will be starting class remote?
Yeah, and this might not be the advice that seems the most helpful, but the reality is to just embrace it. This is how you're starting your medical education, and it might be less than ideal, but just run into it, steer into the skid, if you will. Connect with your peers to the best of your ability. We are all so excited to have you here and to build this culture that we have worked hard to start. And so none of us are any less excited to have you. So my advice for you would be just continue adapting. That's the spirit of the school, is just continued adaptation and growth. So, we don't know what that's going to be like. No one's ever started medical school virtually. So I think everyone's excited to make your journey good too. So.
All right. We have another question from Ben Jacobs. And so actually, I'm going to give this question to Shauna first, and Sarah, I want you to follow right behind her. So the question is, what are some things you wish you knew before entering medical school? Shauna, I'll begin with you.
Some things I wish I knew. One thing I would say is, no, I wish I was, because I'm out of state, I'm from Chicago. I wasn't very familiar with Fort Worth. So it took me a while to explore and really get to know the Fort Worth community. And I mean, I love it. I'm at this point, I'm trying to convince my mom to move down here, but I love this community. And I wish I had have done more research just so that I could have immersed myself sooner. And I say that to say it's easy to go into a bubble of med school, but you have to be cognizant that the world is going on. You want to be active in your communities. So I would really highly recommend learn what your med school, the community and how they give back and learn how they interact, because I've been so blessed with the Fort Worth community, TCU, UNTHSC community, and this has become a real home for me as an out-of-state student.
All right. And Sarah, how would you answer that question for someone coming into medical school?
I think to echo what Dylan said earlier is being adaptable. I think that a lot of people come into med school thinking that what they did in undergrad is going to work for them in med school. Med school is a different beast, and things are hard, and the volume is a lot. And so I would say be adaptable, be open to trying new ways of learning, new ways of collaborating with people, and just be curious.
All right. Curious. Good. Dean Flynn, we have a very fun question for you, and this is from Alina. Alina wants to know, can we get lanyards for students because she is so ready to represent?
I love the question. I don't distribute lanyards, so I will have to send that upstream to somebody who actually can accomplish. I can promise to it, but you might get it about 2026. So great question. Love the spirit. And we can probably do lanyards.
All right. We do have another question. This question is from Sam, and it actually has to do with our SOM Cup that just concluded about an hour and a half ago. If you actually go on social media, Facebook, Twitter, Instagram, search the hashtag 2020 SOM Cup, and you can see all of the amazing things that our students have done in their learning communities this week. So with that said, the questions from Sam is, did the orange team copy the red team or vice versa on their TikTok video? Anybody who doesn't know what that actually means, the TikTok video challenge among the 6 learning communities with the medical students, they had an option to recreate the Full House intro. And so Dylan, did the orange team actually copy the red team? Because you both decided to do that.
Sure. I will say the orange team did win the School of Medicine Cup, so I don't know, do with that what you will. No one copied each other, great minds think alike. Also, we're all getting older, we're not very trendy, so we're just doing whatever's popular right now, trying to be cool. So both the orange team and red team just did what was cool on TikTok right now.
Great. Also, Gail, thank you for your comment, Gail. Gail says she actually loves your background, Dylan. So there's that.
Thank you.
All right. Dean Flynn, I have a serious question for you to answer, because social distancing is a huge topic. Everyone is still practicing social distancing, wearing masks, etc., around the Dallas-Fort Worth area, in Texas at large. But what I want to know is, how have social distancing measures changed how the medical school approaches the longitudinal integrated clerkship and getting students?
Well, I'll start by saying we don't control that environment. So that's the first comment, right? We have to be invited back into the healthcare system and environment by our colleagues who were young once and were medical students once. So this is paradoxical. You have to learn how to deal with any kind of patient. So that's the part of being part of this. The other part is until you're experienced, kind of avoiding exposure to certain things. And again, I would hark back to the HIV moment in time. So I think the social distancing, I think the PPE issue is now going to be here, and it may never leave healthcare again, quite frankly. And so our students will slowly acclimate into the models that their mentors will ask and expect of them. We will be pretty vigilant of this because there will be a there'll be a bell-shaped curve of some of our mentors being maybe overly protective and some of our mentors being maybe not so concerned about what's going on. But our students will figure this out over medical school, and as they start their residency, they'll also very individually start to see what they believe is right and how far to do things for patient care. It is going to impact it. You can't do a physical exam 6 feet away. That goes without saying. So there's where all the adjustments are going to have to occur so we still can do a physical exam on a patient.
And for the students, I want some of you guys to kind of jump in about the LIC. So Connor, you did share a couple photos on our Instagram when you did a takeover a few weeks ago with your LIC mentor. Can you just talk to the new medical students that are coming in about what your LIC experience has been like so far?
Yeah, I guess I've had a really positive LIC experience. My preceptor is Dr. Anga DeSherrill. I think the thing that I enjoy the most from it is being able to have, such a great deep conversations with Dr. Anga DeSherrill just about patients and not having to, worry about like a larger group. So I think the biggest thing that I've enjoyed about it is just being able to have that patient connection and having a physician there to walk me through it and challenge me. And I think those are the big points.
And Sharna, how has your experience been with your LIC mentor?
Oh my gosh, Dr. Bethany Norberg over at JPS Stop 6. I love her. People that are in clinical skills with me on Tuesday, they know, like Sarah and Connor, they know I talk about her all the time because I just learned so much from Dr. Norberg, and she is just amazing to me. The links that she goes through for her patients, I mean, she'll help them sign up for just like food health programs. She knows where all the food pantries are, just nutritional health, mental health. She just really goes the entire gambit to try to treat them as an entire person, and it goes so well with our curriculum that I just learned so much from her. And I actually had a Zoom call with her 2 days ago, and she really echoed a lot of the same frustrations that I had, that she's really just missed her patients and being there. And she talks to her patients, and some of the patients ask about me, and that makes me feel good too, because I'm like, oh, they remember me. Like she talks to my patient panel patient, and they are asking about me too, and I really want to get back to them as well. So I've had a phenomenal experience, and it's honestly just the value placed on primary care is, for me, there's no amount. Like it's invaluable to me just from my experience, because my LIC preceptor, she's been such an inspiration.
All right, and we do have some questions that came in. So Mark Johnson just wants to send a big congratulations to the entire first class for going through this under the most extraordinary circumstances. So thank you for your comment, Mark. You can also jump in. Anyone can jump in, leave some questions. We're still chatting. We do have one question that I think is a little bit lighthearted for the students, and this is from Serena. She wants to know, what are some of the plans you all have for summer break? And let's start with Dylan. Dylan, what are you planning to do this summer?
All right, so I had initially planned to spend the 4 weeks in Belize diving, the second largest barrier reef in the world. Probably not going to do that now, just to be responsible. So in lieu of that, I will probably spend a good amount of time reviewing some medical knowledge. But then depending on if things have opened up, I'll spend time with my family, and then also I'd love to check out some national parks nearby.
Nice. I've been to Belize too, Dylan. Yeah, you're missing out on the experience. Hopefully soon you'll be able to do that again. Connor, what are your plans for the summer?
I think going along Dylan's response, same thing. I think with the uncertainty of what August will look like. I think it'll probably be spent working on my SBT research a little bit and spending time with family, probably staying local for the most part.
And Sharna, I'll come to you, and Sarah, you'll be right after. So Sharna, what are your summer plans?
Again, kind of to go off of Dylan, initially it was Colombia for the summer break and to spend time with friends there. But now, due to the pandemic, more than like, I need to go home to Chicago. I need to go home. I need that food, even if it's takeout or at the corner. I need my pizza. I need the deep dish. So I need to go home, see family, and that is what I'll be doing.
Sarah, what are your plans?
Well, and just to mimic Dylan and Charna, my mom and sister and I were planning on taking a trip to Peru, but that can happen. But I will be able to spend some time with them, so I'm looking forward to that.
Nice. All right. So we do have more questions that came in, and Dean Flynn, since we're on the issue of summer, we have a question from Prima who wants to know, when do you anticipate the next class will start in person after summer break?
So once again, we're not in full control of that destiny. So we have two universities that we need to pay close attention to their expectations and their guidelines. And so those are just now starting to unveil themselves. So I think it probably wouldn't be real wise to suggest a date for a couple reasons. The universities haven't fully announced their plans yet. And this is a pretty fluid virus. So we're not also quite sure what's going to happen between now and another point in time. So certainly, ideally, we would love to be back late summer, early fall. And again, like many other things, when we do come back, the environment will be different than it was before this happened, vis-a-vis social distancing, PPE, and other expectations. It's going to be hard for the universities to find space where larger classes, we're fortunate to be relatively small, can actually be in a setting where they can hit the social distancing standards. So there are a lot of variables that are going to have to be addressed because we're not just a class of 60 and soon to be 120 students. We're also part of two large universities that also have a lot of students in other schools.
All right. And with that, Dean Flynn, that will be the final word. All right. I want to thank everyone for joining me. That's Dean Flynn. I want to thank Sharna, Dylan, Connor, and Sarah. We appreciate you all taking the time to join us for this important conversation about medical school education. All right.
Thank you.
Thanks, y'all.
Thank you.
All right. So I want everybody to make sure that you join us next Thursday, May 28th at 1 p.m. We're going to have another live chat, but this time it's going to be about eye and vision health innovations. We will be joined with a physician from Alcon, and we'll also have our own Dr. Shai Savala, who will be discussing his scientific breakthrough that could one day restore vision to humans who have lost their sight. So that is very big news and should be a great conversation. So thank you all for joining us. Thank you for leaving your questions and participating, and we will see you all next week.